Hey OET aspirants, do you ever find wondering yourself how to ask questions in OET speaking? Hey, in this video, we are going to talk about indicators of information gathering. At the end of this video, you will not only be able to ask appropriate questions to your patients, but will also be able to understand that how examiners assess you while you do so. This is Kirti from Kirti Institute, and let's get started with today's show. Information gathering. This is one of the assessment criteria of OET speaking. It has five features, and in these five features, you need to secure this grade 2, okay, which is competent use and it is equivalent to grade B. First of all, let us see active listening technique. Okay, why it is important to listen carefully. Now, patient will feel that they are heard. Okay, there is healthcare providers, healthcare practitioners who is there to understand their concerns. So, how can you show that you are listening to your patients? Well, there are some verbal communication. Okay, so in OED speaking, first of all, you ask the question to your patient, right? Like, how may I help you today? Now you need to be calm and quiet and be an attentive listener. Okay, listen to your patients carefully. Do not interrupt them. Okay, you can just use some utterances like, okay, all right, I see. That must be very difficult. Okay, that makes total sense. So that is how these small utterances will help the patient to understand that you are engaged in the communication. Okay, now second is non-verbal communication. Now I know that in OET speaking, your audio is recorded. Okay, your voice is recorded, and that audio is sent to OET Melbourne, where there will be two examiners who assess your interview. However, I still feel that it is important that you show even some non-verbal clues because this is simulated conversation, right? And you may feel that you are in the real scenario. So, in order to have this feeling, you can keep your posture open. You can maintain eye contact. You may nod head, okay, or you may show some involvement in the patient's communication by just some non-verbal clues. As I said, this will help you to feel that you are talking with your real patient. Okay, then you may respond to what the patient just said. Okay, so suppose patient says that, well, I really had a terrible day yesterday. I actually went to my friend's party to enjoy, but after having some food, I really started having stomach cramps. I needed to leave the party and come back to home. Oh, I see. That must be really painful. Okay, this is what you are responding to what the patient said. Okay, or just imagine that your patient explains the story and you are in a closed posture, not maintaining eye contact. How your patient will feel, right? So that is why it is important to give the response. Okay, that must be awful. Okay, I know it must be very painful. Or you may just rephrase or paraphrase the statement. Okay, you may say that, okay, let me get you. You said that you had your friend's party yesterday, you had some food, and after taking that diet, you started having some cramps in your tummy, and you are here for the examination. Is that right? Okay, so now this shows that you are an active listener, you are able to understand what the patient says, you are able to recall and paraphrase in your own words. Okay, and this is the stage from where your score will start increasing. All right, now let's see open-ended to closed-ended questions. Now, open-ended questions are the questions which cannot be answered in yes or no. Okay, whereas closed-ended questions are the questions that can be answered in yes or no or in short phrases. Okay, so as a healthcare provider, you will ask first open-ended question and then we'll move towards the closed-ended. Let's see how to do that. Suppose this is a setting is emergency department and it is triage, and this is a card of medicine which can be used even for nurses. You are speaking to a 55-year-old patient who has come to the department with a 3-day history of painful rashes on upper back. Okay, so now I understood that this is a 55-year-old patient having this rashes on upper back for 3 days and it is painful. Okay, your first bullet point says that find out the reason for patient's visit. Okay, and the second bullet point says that find out more information about the symptoms. So here you may start by greeting your patient. Okay, good evening. My name is Kirti and I am the doctor working in this emergency department. May I know your name and age, please? So here you can understand that the scenario is totally new. Your patient is totally new. You are meeting your patient for the first time. The condition is yet stable. Okay, so you may ask your patient to tell you the name. Then you may ask that, how may I help you today? Now, this is again an open-ended question. You are inviting patient to explain what happened with him or her. Okay, now you need to listen carefully. Okay, suppose patient says that I'm having this rashes on my upper back. Okay, so you're having some rashes on your upper back. Could you please tell me a bit more about your rashes? Okay, now suppose patient says that, sure, I have this rashes for about 3 days, and it is very painful and it's on my upper back. I took paracetamol, but it really didn't work. Okay, initially it was very mild and was not that much painful, but within 3 days it has converted into blisters and it is now very, very painful. Okay, now you can understand that patient has covered duration, patient has covered treatment, and patient has covered changes in severity. But what is not covered, that is previous occurrences and any trigger factors. For now, these two questions, you may ask closed-ended questions. Okay, so you may ask like, have you ever come across any disease conditions like chickenpox or shingles in your life? Okay, so patient may say yes or no. And then you are moving to the next question that do you think that anything is responsible to bring the symptoms on? Okay, so patient may give you some information like yes or no, or patient may explain some of the things. So let the patient get involved in this communication. Okay, and whatever information you are gathering from the patient should be written on the card. Okay, like duration, here you can write something like 3 days. Okay, here you can write previous occurrences of chicken pox, then you just put a tick mark on it. Okay, changes in severity, less severe at the beginning. Treatment received, write down PCM. Any trigger not identified. So like this you can make short notes on your card, okay, during the exam as well, so that it will be easy for you to summarize. Okay, so one more time, you may ask open-ended questions like, how may I help you today? Or could you please tell me a bit more about your symptoms? And then moving towards the close-ended questions. Okay, now then you have to summarize the information. As I said, you can make short notes, and now you can summarize that. Okay, Mr. Let me summarize what we have discussed today. You are here because of your painful rashes on your upper back. It is there for last 3 days. You had chickenpox as a child. Your symptoms were less severe when it started, but it's more severe now. You try to relieve the symptoms by paracetamol, however, it's ineffective, and you can't find out if something has caused the symptoms. Is that all correct? Yeah, bingo. Okay, so this much you should do in your exam. Now, avoid compound or leading questions. So first of all, let us understand what is compound question and what is leading questions. So now compound questions are questions which are asked together. Okay, you are asking two different questions at the same time. Okay, so let's see the examples. That is, do you exercise regularly and what about your diet? Now think that the patients they are already into the problems, they may not be able to recall your both the questions or may not give you enough information on both the points, right? So it is essential that you ask one question at a time. Okay, first of all, you may ask that do you exercise regularly? Let the patient answer, and then you may ask then what about your diet? Okay, so suppose second example, do you know anything about asthma and its causes? Again, you're asking what is asthma and what are the causes? Do you know anything? Okay, so this will confuse the patient more. Now, second is leading questions. Now, leading questions means you are putting your thoughts on patients. You are imposing your thoughts on the patients. Okay, suppose you are under lots of stress, aren't you? So you think that patient is under a lot of stress, and you are then asking the patient that you are under a lot of stress. Now, patient will start thinking that, yeah, I'm in stress. Yeah, you are right. No, we don't want that to happen. Rather, you may ask that, how are you feeling now? Okay? You can't recall what happened yesterday, can you? No. What happened yesterday? Could you please tell me? Okay, let the patient try to recall. Okay, you should not think that patient won't be able to recall and then expecting that patient will say yes or no. No, this is not an appropriate way of asking the question. Okay, is it excruciating pain? No, rather ask what kind of pain do you have, or how will you rate your pain between 0 to 10? Okay, so let the patient explain that what kind of pain he or she is in. Okay, fine. Clarifying vague statements. Now, this is also one of the important points, because when you are appearing for the test, you may feel that, hey, I couldn't understood what the patient said. Can I ask for a clarification? Of course, yes. This is one of your assessment criteria. So rather than going blindly, it is always better that you ask for the clarifications. Okay. The first example is I love to eat lots of fatty food. Now, suppose you couldn't understand what does it mean by fatty foods. So you may say that I would like to understand your thoughts further. Could you tell me more about your diet? Okay, so you are asking for the clarification about fatty food. I'm concerned about misuse of inhaler. Now you couldn't understand what does it mean by misuse, whether the patient is talking about overuse or underuse or not using inhaler when it is needed. So what exactly patient wants to say? So it is always better to ask, could you tell me what you mean by misuse? Okay, let the patient give you some clarifications. And sometimes it really happens during the real conversation as well that we are communicating, and sometimes, we get brain fog. We can't understand what is going on, and you may get totally lost. Okay, if it happens in OET speaking as well, you may say that, oh, sorry, I couldn't catch that. Could you tell me again what you did after he cut his finger with kitchen knife? So the last point you heard that he cut his finger with kitchen knife and then you got lost. Okay, so you may ask that, could you please repeat that for me? Okay, so that's it for today. Yeah, we are done, right? So let's come back to all the criteria. Facilitating the patient's narrative with active listening technique. All right. Don't interrupt your patient, okay? But, okay. Yeah, that makes sense. Okay, so such a small utterances will help the patient to understand that you are listening to them actively. Using initially open-ended questions and then moving to closed-ended questions. Okay, so ask, could you please tell me more about it? Okay, what do you know about asthma? So ask open-ended questions and then move towards the closed-ended questions. Do not ask more than one question at a time. It is not a good idea. And do not ask any leading questions. Don't impose your thoughts on patients. Okay, always clarify the statements which are vague or need amplifications. If you haven't understood anything during the conversation, it is always better to ask your interlocutor. Okay, and at the end of information gathering, not at the end of whole communication, at the end of information gathering, you should summarize the information to just make sure that you have understood everything correctly. If not, the patient may correct you. No, I have this pain for last 5 days, not for 3 days. It's okay, I have noted it down. Okay, because you are summarizing to invite corrections or further information. Okay, so don't get stuck if the patient corrects you. Okay, don't think that, oh, I am in exam, I couldn't focus, he said for 5 days and I'm repeating with 3 days. It's okay, it may happen. All right, so that's it for today. I hope this video is informative. And if you want me to make more videos, or if you want to practice with me one on one that how to ask questions or how to prepare for OET, you can always contact me on the number flashing on your screen. Okay, so see you soon in the next video. Till then, bye bye.